Georgia is actually a very immigrant and refugee-friendly state. We have some of the best temperatures and climate, foods.
People are really great, and you have cities like Clarkston that are refugee cities. You have so many people from other countries. You have Atlanta as a hub that brings people all the time from other countries to work.
However, in the healthcare system, there's a supply and demand issue. The medical schools are not fast enough in producing medical physicians to keep up with the population growth. Forbes listed Georgia as one of the states that has the lowest hospital outcomes, most inaccessible healthcare, highest infant mortality, highest maternal mortality. With the population boom, we are in the midst of a crisis where we can't take care of our own patients. We have such unique needs in the South, especially in Georgia, being that it is a stroke belt. There are refugees that come to this country that have healthcare experience, and that is a gift to us. However, we have not really created that infrastructure to absorb all the healthcare workforce that is coming into our state. These are opportunities that we are letting go.
I practiced clinical psychology for 17 years before coming here. And so I contacted the licensing board here in Georgia for psychologists. And I found out very quickly that there was no option to validate my title. So that was disappointing because I realized I couldn't work here.
I had the pleasure of meeting with trained American doctors, both in the French Medical Institute in Kabul and also in the Khan University Hospital in Karachi. They came and they were helping in training the physicians in these two hospitals that I did my residency and work. So having the experience working along them has helped me to learn from them and to be more confident that if I'm going to practice here in the United States, it wouldn't be very different from the practice that I was doing in Afghanistan. However, it is a long route for me. I have to take so many exams and I have to do the training again for 4 to 5 years again to become a practicing physician here.
In New York, I got the opportunity to work in different practice and also just as like an observership, and also did like an actual work as a clinical assistant, and work also for 3 years as an assistant physician in a primary care practice in upstate New York. So I was kind of expecting the same opportunity when I was in Georgia, in New York State, but I was kind of surprised that I do not have the same opportunities. Going to the office, give them my CV. It wasn't anything. It doesn't mean anything, and it cannot open doors for me.
I think the policies that I would love to see some change would be just constructing a pathway so that healthcare people can validate their titles. And the way other countries do it is they use their universities to validate those titles, and then they have a licensing board do an exam like everybody else.
Our neighbor state, Tennessee, they have changed their medical rules. They had announced that beginning from 2024, for international medical graduates, they don't have to do the whole residency again. They will be working under the supervision of another specialist for some years. And if that specialist is going to certify that physician, then in a few years he can start practicing independently. I hope that the state of Georgia is also planning to do something like what Tennessee has started, because that would help to keep the physicians here.
have lots of students here who have DACA who would stay here in Georgia and work within the communities that they come with, also in rural communities, and are unable to. For nurses who have DACA, that's a huge barrier there because it's unclear if they can or not apply for a nursing license. There are several programs where nurses can be assigned to work in rural areas in exchange for loan forgivenesses. But again, if you have DACA or temporary protected status, another temporary type of immigration visa, you don't qualify for those.
And of course you will be losing people because people move if there's better opportunities elsewhere. I know I would move if I didn't have the opportunity to go to school again, because after practicing for 17 years and having experience working with trauma, this is what I love to do. I don't see myself working in anything else.
Here you have a pool of physicians who can be such an incredible asset to us. So we need to find ways to assimilate them, either provide grants for them, to assist them to take the preparatory courses. We need to find licenses, be able to pay them a small stipend, be under a supervised physician in rural Georgia, and they become better candidates for a future residency program. I mean, I think those are such innovative ideas, and I think Georgia should be open to ideas like that.